Okay, good afternoon, everyone, and thanks so much for joining our webinar this afternoon. Really glad that you're all able to be here. We have a very full house. I think we had over 100 people accept this meeting, and right now we're almost at 70 participants. So I'm just going to do a really brief introduction and welcome, and then I'm going to hand it over to Mia Edidin from Perinatal Support Washington. And my name is Elisa Wadlick, and I'm from Ounce, Washington. I'm the Manager of Quality Improvement, for those of you who don't know me. So just a few notes before we get started. You were all muted upon entering. So because we have such a large group, we're going to ask that you stay muted unless you are speaking or need to ask a question. We are recording. And this recording will be available once we're finished, and we'll be sending out a link for that. And I believe it will be posted to our new Ounce Washington website. You can use the chat for questions. We'll be monitoring that throughout the webinar, and we will have plenty of time for questions and discussions at the end. And I think those are all of my notes. So I'm going to hand it over to Mia. And yes, I will stop sharing my screen.
Okay, I think you can see me. Hopefully you can hear me. Lovely to see all of you today. I'm just getting my screen set up here. 1 second. In talking with the folks over at Ounce, they had asked me to put together a webinar for home visitors and beyond around thinking about how to support clients during this COVID-19 pandemic. I'm going to be presenting a couple of different models. When thinking about this, I was thinking about what would be an easy model that sort of anybody could use in order to frame, thinking about how we might be responding to this, how our loved ones might be responding to this, and how our clients might be responding to this. And also that could be usable for folks who are both mental health professionals and not, so that we weren't using sort of overly clinical language or thinking about things that would only be useful to one type of provider. And so I've tried to keep things fairly broad, and hopefully it will meet all your needs. I should stop and say quickly that my name is Mia Edidin, and I am the Clinical Director at Perinatal Support Washington. So I'm going to get going. So one of the things I just sort of wanted to frame this discussion a little bit, because I think that there's been a lot of, kind of questioning and wondering about sort of what we're supposed to do around managing mental health during COVID-19 pandemic. And I want to sort of point out that it's not inherently different. The principles on how we would address just overall like emotional wellness and mental health complications is the same, but I might just, sort of talk about the ways that it might be harder right now because we're stressed, because we're triggered, because we're overwhelmed, because access has changed in a lot of ways, because we can't leave the house. And so, I think that there can be this, oh no, we don't know how to do this. And I want to encourage everyone that no matter who you are and what kind of helper or provider that you are, that you do know how to do this. You know how to make relationships with your clients. You know how to talk about difficult things. You know how to support them. And I want you to remember that and sort of not kind of, rush into this, like, I don't know how to do this and everything is different. And you can certainly honor that experience, that it feels that way. And then as you honor that experience, you can also move into this, actually, I have the skills and maybe I just need to be reminded, and maybe we can think about this together. The other thing that I just sort of want to clarify is that perhaps our expectations are off in terms of what we're expecting from all of the learning opportunities and all of the things we're supposed to be doing to address our emotional wellness during this time. And I again sort of wanted to frame sort of what it is that we're trying to do. It is impossible to take away the anxiety and the worry that we all might be feeling about all the different things happening in our lives. So, you know, about maybe financial stresses, about, you know, things that are happening with our kiddos, about COVID-19 itself. And I don't know if that should be our goal. And I think that, you know, sometimes I hear this, well, how do I make the anxiety go away? Or how do I make the worry go away? And I'd like to just sort of like put this in our minds that really the strategies and the things that we might be talking about managing anxiety and worry are really strategies to help them feel more manageable, not for them to go away. And if we're thinking that they're going to go away, then we're going to be trying a lot of the things that, you know, we're seeing posted all over social media and all the experts are saying, and we're going to say it's not working, it's not working. So, and then we're going to be telling ourselves that either we're doing it wrong or they're wrong or someone's wrong in this scenario. And I want to also really encourage us to be thinking about what it is that we're expecting, you know, when we're trying to take care of ourselves. And I really think that the expectation would be to get through, right? To get through as best we can, and to find our resilience, to look for our resiliency in ourselves and our loved ones and our kiddos and our communities. And you know, to hope that managing the anxiety and the worry, that we do it enough that we can get back into the things that we need to be doing on a daily basis. So caring for our kiddos, if we're trying to work as well, caring for ourselves, you know, things like this. So the other thing I kind of want to talk about is, you know, I've seen, you know, that, you know, just because our lives are online these days, there's so much information, and I see like all of these like lists, right? These lists of things we're supposed to do. We're supposed to, you know, be reaching out to our friends and family. We're supposed to be exercising. We're supposed to be like meditating. We're supposed to be like doing all of these things, which I think in the best of circumstances are probably on all of our to-do lists, and we're trying to figure out how to do already. And then in these circumstances, like, you know, we're like grappling to try and like put all these things together at the same time that like none of our normal structures are in place. And so I might really sort of wonder, you know, like maybe if we did all of the things that the experts told us to do, we would feel better, but like who can really do all of those things? And then the other thing that I might just want to point out before we kind of jump in more to some of the things to do, is that not all of the recommendations are for all of the people. So for instance, I've had many sessions with parents over the last several weeks, and groups I run a perinatal support group of parents saying, well, I'm doing all of these things and it's really not working. And when we sort of break it down, it seems like folks aren't really thinking critically about some of the things that we're being asked to do. So for instance, you know, for all the helpers that are on the call today, perhaps, you know, we're spending a lot of time in relationship with people all day long online. And I'm hearing this, well, I'm supposed to be connecting with all the people in my life. And then when they try and go and connect with their people in their life, they're really just feeling depleted and exhausted. And those things like, you know, trying to get Zoom calls with friends or trying to connect with family are feeling like one more thing to do. And so I want to encourage you to think about that it's possible, for instance, that you actually have a lot more connection with people than you think that you're having, and you don't need any more connection. So even though the expert is saying connect, 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 that maybe you're doing that. Or in another way to think about it is for folks that are fairly introverted, right? Connecting might actually be quite exhausting and difficult, and that might not be the best thing for you. So encouraging you all to think that you're the experts and that you actually know yourself better than that you think you do. And if you were to reflect on a time when you weren't stressed, and think about the things that worked for you then, those are the things that I might gravitate towards now, as opposed to, you know, trying to like, you know, follow these lists of things and, you know, start new mindfulness practices and all of these things, which I just really want to honor are incredibly difficult in the best of circumstances. So really, really holding ourselves with grace, really thinking about sort of, you know, customizing the approach of what we might, you know, do for ourselves. In order to do that, we need to have a sort of a sense of what's happening for ourselves, right? We need to be able to have a way of taking stock of like, gosh, what am I going through? To then decide sort of what we might want to do. And I'm going to talk about, you know, common responses to stressful situations. And again, I really want you to be thinking about yourself, your loved one, and your clients, because we're really all in this together. This is not just about supporting our clients' mental health. This is, I think, about all being humans together during this time. Just a few more things. I touched on this, this idea that nothing is going to work completely, but if we're looking for things, right, could it work momentarily, right? Does getting outside for a few breaths help you re-engage and keep going? Great. It's not going to make homeschooling, working, cooking, cleaning all fun and enjoyable, right? But it might help you continue on. I talked a little about the advice, but the other thing that I want to say is, I think a lot of you probably know this concept that, like, you can't jump into problem solving and advice giving until you sort of listen to what's happening. And I would encourage you to do that for yourselves, and I would encourage you to do that for your loved one and your clients as well. First, we need to listen. First, we need to hear what's going on, and then we could maybe move into action. And if we move into action, even if those things are sort of well-intentioned and, right, like, it can't hurt to be mindful and to practice meditation. It can't hurt to go outside and do exercise. But if it's really not addressing the thing that's happening for you, then you might be applying, like, really well-intentioned good ideas to the wrong problem. So really thinking about, like, stopping and listening to yourself or listening to the folks around you before you then start to kind of figure out what to do. And this is really just about getting through. It's not about making things go away. It's not about, finding, peace and contentment in a really difficult time, although I would hope that you could find moments of that. The other thing I just want to talk a little bit about is this idea of resilience, and really thinking about, like, community and culturally informed ways of finding resilience. And no matter who we are and no matter where we're from, we all have a history or a tradition, or a community to draw from. And so I might just put a couple, these are sort of seeds that I want to plant for you. I'm not going to go more into detail, but really think about sort of, where were you taught to draw strength to persevere? Could you think of a person? Could you think of a scenario? Could you think of a community event that happened, either in your lifetime or that's been passed down to you in some way? And so, where can we draw strength? Where can we connect to the people that came before us, right? How did your grandmothers endure? How did your ancestors endure? What were those things that they did? What were those things that they said? Do you have traditions that you use in times of grief or in times of sorrow? What do those look like? Traditions, rituals, really they're about helping people kind of manage everyday life experiences and events that happen. And I think that there might be some things that we could each draw on from our own traditions and our own cultures that can help us think about how to navigate this. So if you don't know sort of off the top of your head, oh, this is how, my people do this, or this is how, my grandmothers before me have done it, who might know, right? Is this something that you'd like to think about? Who could you ask? Where would you look? Is this something that you might want to spend a little bit of time on? Something that you could do perhaps instead of scrolling through social media, or, perhaps, doing some of the other things, but really, seeing if there's some things that you could find that feel, that you could connect with and actually feel perhaps kind of energy building, right? Or even grounding for you to be in, so that we're not all sort of flailing around right now. So I sort of talked earlier that I was looking for a model that would really help us all think through how we might be responding. And I think that, because a lot of what's happening can feel traumatic and it can feel like we're constantly being re-traumatized, I decided to use this fight, flight, freeze, or fawn model. And there's a fifth F that I'm going to talk about at the end, which is flock, which I think is an opportunity for us all to really think again about how we're kind of coming together and how we're supporting ourselves and each other. And quickly, I just want to say that typically, someone might have a common response pattern, so we might respond in similar ways when things that are threatening happen to us. But we also might be moving in and out of these states at different times. So it's not like, we only have one out of these four experiences. And the other thing I'm going to talk about is that, in some ways we can't necessarily kind of in this moment completely help how we're responding. And all of these sort of different ways of responding to things are okay, right? There's nothing wrong with any of these. Our goal would be to think about finding awareness, right? That, oh, this is what's happening for me, or I am moving into a fight response, or I'm coming out of a fight response, or recognizing if that's perhaps something you do more often. and thinking about the ways in which that might be showing up for you now. We're going to talk about ways that you could sort of help calm or soothe that response. And then we're also going to be talking about really specifically how these are showing up right now. So I'm going to really contextualize them to COVID-19 so that we can like use some really good examples and really understand. Yeah, so I will get going with that. So just quickly, a lot of us are familiar with this model. So fight is like an action-oriented sort of taking the problem on. Oftentimes in fight response, because it's a really sort of activated state, it's usually like a state of emergency, we can sort of find a singular problem. Some of us are better than others in identifying what the actual problem to solve is, and sometimes we can choose a problem that may not be the problem. And I'm going to talk more about that. Some of the emotions that can be associated with fight can be anger or aggression. Flight is also action-oriented. It's also in a very activated state. It's also in a very threatened state, and instead of going towards the problem, which is, you know, the fight response, the instinct is to get away from the problem and to stay safe and to be safe. And a common feeling could be fear or overwhelm. Freeze is the do nothing, right? So in the face of a threat, you know, we don't do something. That might be, you know, an understandable safety response. If they freeze, maybe they won't see me. You know, I won't be, you know, doing any like, you know, movements that will draw attention to me, things like that. Some feelings that you might associate with freeze is worry, fear, fretting. And then this last one, fawn, you may or may not be as familiar. Fawn is really in the face of a threat, in the face of the danger, rather than going towards it like fight, and rather than going away from it like flight. Fawn is sort of going around it. Fawn is figuring out how to make this threat as acceptable as possible. And so there can be some appeasing, there can be some smoothing over or trying to make it right. And we're going to talk a lot about how that's showing up right now. Some of the feelings that could be coming up are fear or denial. So I really, again, really want to, you know, highlight that all of these responses are okay. We all move through these as human. They're human responses to the experience of threat. And the goal is to be aware of these patterns and to have some sense of agency of what you can do if you, a loved one or a client, is in one of these, and also to be able to recognize, oh, I think this is what's happening for them. So fight response happens when you feel you're in danger, but you believe you can win, right? So you're not in your rational brain when you're in the fight response. You're in the, you know, I've singularly found something and I'm going to take it on. Some things that, you know, you might see in someone in the fight mode, again, that easily identifiable source of distress, right? So you kind of figure out something and you really go for it. And this could be in all different directions, you know, so like one of the things that we could see, you know, right now, I'm going to talk a little bit more about the particular COVID responses that we might be if you're stressed about COVID and your kids are being rambunctious and misbehaving in the house, right? They become the source of the kind of like where all of your emotions or all of your energy is directed, because if you figure out that, then you'll feel okay. And so it's a kind of a good example of sometimes it can be misdirected. So you can also fight can be directed towards yourself, right? So you can also be blaming towards yourself and identify yourself as the problem. So it's not always externalizing. So it can be yourself, your partner, your kids. It could be the grocery store clerk, right? When there's no toilet paper. It can be the person that cuts in front of you. Some things we often see in folks that might have a fight response is the tendency towards perfectionism or high expectations. This is another way of sort of taking it on, right? I'm going to do all the things to address the problem. And it's a way of sort of, you know, trying to solve something that's happening for you. Again, because it's action oriented, people are going to feel a lot of physical symptoms. We're going to talk a lot about sort of like how to work with those. And then, you know, fight really looks like self-preservation, right? Someone is in the fight mode is trying to, you know, protect themselves as best they can. So some ways that we're seeing this show up, like really specifically in COVID, and some things that might be unhelpful. So, blaming everyone or anyone. So this could be, on any of the people around us. We all might be choosing differently, who we're going to be blaming. They're the folks that, perhaps are blaming people on social media. They're the ones, I've seen some people, sort of blame people for a death in the community from COVID, which was, obviously very tragic. But sort of, say something along the lines of, if you went out of your house, you're to blame for this person's death. So, again, sort of not necessarily identifying the problem as, COVID is the problem. And certainly everybody needs to be staying home, but trying to solve the problem or take on the problem by fighting with people in their lives. There can be this every person for themselves mentality. So that can look like hoarding, right? So the folks that are like, I need to go get what I need to get to protect myself and my family, and that's all that matters, can be someone who is in a fight response for COVID. Feeling like things are single-handedly on them, like so nobody else gets it. Everybody else is incompetent or selfish. So again, the person who feels like I just have to do it all on my own and nobody else knows how to do it. We might also see some rebellion. Again, if you think about folks in the fight response, going towards a danger, right? Those are the folks that might also say, I'm going to take this on. You can't get me, like, I'm invincible, something like that, or feeling as though they know best. So some helpful ways that we're seeing this, and you're going to notice that like some of the things that are on the like unhelpful list and some of the things that are on the helpful list might be the same, because sometimes it's a little bit of the tone is a little different. So some helpful ways, our governor has asked us to implore people to stay home. And so people that are sort of, pointing out that people aren't staying home and trying to get them to stay home in some ways can also be seen as contributing positively. The other way that this is showing up is, people who are really pointing out and talking about inequitable systems and inequitable experiences during COVID. That's another really positive way that folks that sort of can really sort of, focus on something as being the problem can really be helping right now. These are the folks that are sort of willing to take on a little more risk, right? So they're the folks that maybe are willing to go out to the grocery store. They're the ones who are willing to reach out to the neighbor. They're the ones to sort of put things into place and do things, right? It's very active. They're also the folks that are going to be organizing right now, potentially. This doesn't mean that folks in some of the other categories aren't doing this, but people in the fight are going to say, oh, if I can make 1,000 masks and deliver them to the hospital, I'll feel like I'm contributing to this experience. And so they're the ones organizing people and organizing projects and doing lots of things because, again, they've identified a problem and they're taking it on directly. So again, fight is not always, just the sort of negative thing that we talk about. But things to consider, right? If this is a response that you or someone you love or your client is experiencing, really understanding that fight is like a physiological readiness to act. And so, similar to maybe how you would manage anxiety, which is also sort of an activating, has lots of built up, pent up energy, we might want to look for ways, healthy ways to discharge the energy. So unhealthy ways would be fighting, right? Unhealthy ways would be taking it out on yourself or others, but healthy ways would be sort of moving your body. So exercise, dancing, listening to music, cleaning, roughhousing with kiddos, which is actually like a great thing to be doing right now. Helps kids like rev up and then calm down and then rev up and then calm down. Fixing things, volunteering, community organizing. These are all really great things that someone who's kind of in this place could be thinking about ways to sort of put their energy. So flight. Flight, you all probably know a bit about. Flight is in response to a perceived danger. You get out of there, right? Like you've identified that the best way to manage the situation is to leave. Again, that sounds perfectly reasonable in some circumstances. So again, this is not good or bad. Common things that we would see for folks that respond with flight, could be kind of in the day-to-day life being chronically busy, right? Or also being perfectionistic. So in an attempt to outrun the danger, right? You're too busy for it to get to you, or getting ahead of the danger by being perfect. So those are things that we could see. Flight is also active, but it's moving away from the danger, not moving towards the danger. It can also look like obsessive thinking, or compulsive behavior, right? So you're trying to outthink the danger. You're trying to get away from it, right? And so obsessive thinking is an attempt to manage anxiety. So if I count 5 times, I will manage the anxiety. So it's sort of, again, it's a way of kind of running from the thing that's concerning or scary. Things that you could feel, panicky or anxiety, and you might be acting these out. And you're going to feel restless as well, because again, it's an action oriented, so you're unable to sit still or feel relaxed. So some unhealthy ways that we're seeing this show up today. Folks that are physically leaving the area, taking extended vacations or trying to get out, trying to run from COVID, which we're seeing is, right, it's fairly hard to do that. Anything that is preventing us from being present. So increased substance use or abuse, gambling, compulsive shopping, compulsive porn watching, binge watching Netflix, although I'm going to put a little note there, like if binge watching Netflix is working for you right now, there's no need to change that. So again, some of the things you see on this list are going to be on other lists as well. And then, folks that are in the flight mode also might be implementing, pretty extreme precautions, so they might be the folks, who, are sort of, putting things into place that are probably above and beyond what needs to be. We should all be being cautious and doing the things that are being recommended by, all of the medical experts. But things like, people sleeping in separate rooms in the home, even though there's not any illness in the house. I talked with one person who wasn't putting on any makeup and wasn't putting on orthodontia, even though they were at home and sequestered and haven't had any contact with people because the experts had told them not to touch their face or their nose or their eyes. So really taking it to extreme. So some healthy ways that we're seeing this, right? Staying home, right? These are the folks that are like, COVID's out there, I'm running the opposite direction, I'm staying home. That's great. Staying away from other people, that's wonderful. Taking this super seriously, right? So folks that are in the flight response are like, oh, I'm afraid of that, right? And they really take that fear seriously. That's great. They're also the ones not being risky. So again, they're listening and they're staying home and they're doing the things they need to do. Some things to consider. So again, flight is a response to, feeling like you need to get away from something. But if you imagine, like, as you can probably imagine, it's hard to get away from COVID. So our strategies to get away from, the anxiety or worry around COVID-19 would be to take a break from the bombardment of social media. It would also be to monitor sort of what you're using to perhaps get away from the fear or away from the threat. So monitoring substance use or any other behaviors that are harmful. Again, if watching Netflix is working for you, that is okay. You do not need to stop watching Netflix. But if watching Netflix is your strategy and you are not able to attend to other things in your life because that's how you're managing your fear and your worry, then maybe we would want to think about adding in some of these other things. Getting outside regularly in nature, if that's possible. I know that's not possible for everybody. Engage in things that help you be present, right? So flight, again, is trying to get away from the present. And if you can be sort of mindful in the moment, again, just looking for moments of, being present. You do not have to be present all the time and sort of, stand into the full force of the worry and fear of COVID-19. That's not what we're asking. Engaging in grounding activities, again. So like, again, if you're thinking about like flight as running, thinking about things that you do that sort of keep you firmly planted on the ground and keep you firmly grounded. So like, things like this image that I put on here of imagining your tree roots that are growing into the ground and steadying you and holding you up. And then seeking out connections with others. So flight can also bring you away from people because you're sort of busy trying to get away from the threat or the fear. So connecting with others. Freeze. So when we experience freeze, it's often that we can be overwhelmed with information and we can feel paralyzed. So unlike fight or flight, which those are fairly action oriented, and they can be externalizing. They can also, be a little bit internalizing. The experience of freeze, though, is primarily internalizing, right? So you're kind of inside yourself, kind of trying to figure out what to do. So things that we might see, some spacing out or feeling unreal, feeling physically or mentally frozen, experiencing dissociation. Again, I want to be really clear that we all dissociate. It's not a question of some people do this and some people don't. Some people do it more. Some people use it more as a coping skill than other people. And so some dissociation, which really, you know, binge watching Netflix is some dissociation, can be okay. But again, if we're dissociating and not able to connect with our kiddos, if we're dissociating and sort of disconnected from our partners, and sort of not able to do what we need to do, then that's when we might want to sort of bring ourselves back and find some grounding. Freeze is very much isolating from the outside world. It could be the, like, you know, pull the covers over your head. Difficulty or making decisions or problem solving. So I think that in some ways, maybe a lot of people are experiencing this, right? When we're kind of overwhelmed, you know, we are not sort of in our like problem solving, decision making part of our brain. And so freeze is that experience. So it can be really hard. You have a lot of information, you can't sort through it to make the decisions that you need. Worrying a lot could be something that you experience. And then also there might be a mistrust of others. So generally finding solitude because you can know what to expect on your own, and other people can feel dangerous or unknown. So some of the things that we're seeing that, you know, could be challenging during this pandemic, folks that are in the freeze mode may feel like their own safety or their family's safety is jeopardized by others. Again, it's that mistrust or that feeling that other people are unsafe. Shutting down or staying in bed, feeling a sense of dread or hopelessness, not knowing what to do. So like having too much information and then feeling lost in it, not able to be productive at work. Again, back to that kind of the cognitive experience of it, not being able to problem solve simple or complex things and needing other people to help make decisions. And then again, dissociating. So some healthy ways that we're seeing this, staying home. Right? That's what we're asking people to do. The governor wants us to stay home. And so folks in that freeze place, they're staying home. That's great. They have the ability to hunker down without being stir crazy. So that's wonderful. They often have the ability to be by themselves. So in some ways, they're sort of well suited, you know, they're the folks that are like, I'm on my couch, got my computer, have my coffee or my tea or whatever it is, I'm fine by here. Like, I don't need anybody else, you know, I'm good. And, you know, if that's working for them, great. But a lot of people have other things that they need to be doing. And when you're in the freeze mode, it can be really hard to do the other things that you need to do, including things like taking care of kiddos, you know, taking care of work, multitasking, things like that. And I do want to encourage people that, right, we're not supposed to be doing all the things right now, but I do imagine that we all have things that we need to be doing. So some things to consider. Again, sort of different from fight or flight. In freeze, we're actually looking to like kind of come alive, right, or to energize ourselves. So we're not looking to discharge energy, but we're looking to like bring energy in, sort of like kind of come back to life, kind of like the spring flowers poking through the winter snow. So we can do this in a couple of ways. We can try and physically do this, so exercise, dance, movement. Or there can be emotional strategies, so things that sort of get us to kind of come back. So listening to music that really gets us going, writing if that's something that we like to do, or journaling, reading, again, so like using your imagination could be helpful, creating art. And then we'd want to stay away from things like watching TV or zoning out, or things that sort of encourage you to be in that hunkered down place. Probably turning off social media if that's the thing that you find kind of gets you in that freeze place, because you become overwhelmed by just all the things that are constantly happening. And then the other things, because freeze is like, again, that's really internalizing and pulling away from people, you might find that it can actually feel good to connect with people. Especially, I mean, or initially it might be hard, but it also might be something that ultimately makes you feel good. Okay, so Fawn. Fawn might be something that you may or may not be as familiar with. Fawn is kind of what I was talking about before, in the sense of danger, in the sense of threat. Instead of going towards it or running from it, you kind of like go around it. You kind of are, I'm gonna do all the things that I can do to make this work as best I can. I can't take on the problem directly, so I'm going to do what I can. And some of the things that we see with this is people pleasing, right? Which you can imagine, if there's something wrong and you try and make everybody happy, that is a strategy to making sort of the best out of a worse scenario in some ways. But, you know, in that people pleasing, you're often very concerned with other people. You're very concerned with what other people want. You may not be as concerned with yourself. So you might be unlikely to sort of say how you feel or do what you think is needed. Instead, you're trying to like manage conflict is kind of a big part of this. It could look like caring for others. Lots of saying yes. There might be some struggling with low self-esteem. There could be feelings of being taken advantage of. And your response when there is a problem, when there's a perceived threat like COVID, is to feel guilty and then turn your attention towards trying to take care of people and ease suffering, which again is not the worst thing in the world. Like I said, all of these things are experiences that we might be moving in and out of ourselves, or we might be responding to more commonly or more often. You know, and so some unhealthy ways that we may be seeing this is these are the folks that are also sort of taking the public health recommendations and amplifying them by 10, you know, being like the, you know, the Uber citizen, you know. So the folks in Fawn are like the folks that, you know, have like an elaborate, you know, front door regime of like, you know, clothes and hampers and hand sanitizer and, you know, 10 checklists. And, you know, even though some of us might be like, oh, I kind of would like to do that, the folks in Fawn are like done. They got it all done. It's like all set. It's like, you know, ready to go. You know, they've done all this really hard work. You know, they might be the ones to put an extra positive spin. So we've seen lots of this on social media. This is the time to connect with all your loved ones. The earth needed this break. Homeschooling so magical. I'm so glad that we're mostly connected family on the planet. You know, so really looking for those silver linings, which there's nothing wrong with that. Again, we're looking for some balance here. They may try and take care of all of the needs of everyone and not pay attention to the needs of themselves. They might put themselves at risk, right? So they might not be taking care of their needs, or they might be disregarding their needs or their safety to appease and take care of other people. So some healthy ways that we're seeing this, right? Taking care of all the things, like that's a wonderful thing. You know, caretakers are really wonderful. There's nothing wrong with that. Again, we're looking for balance. They're the teacher's pet of following the rules on COVID-19. Again, nothing wrong with that. That's a good thing. Highly capable of doing many things and getting it done well, right? So those are the folks that like week 1 had the like homeschooling, like Pinterest, you know, boards on their, you know, on their wall, you know, with like every day, you know, every minute mapped out. And we're probably actually doing a fairly good job with it, not just showing, you know, showing on social media that they were, you know, appearing to do well. So they're the ones, you know, cooking, cleaning, homeschooling, you know, and they have 4 kiddos under their feet. Where everyone else is like, how are you doing that? Well, some things to consider is they might be doing that right at a cost, and that cost might be themselves. So really thinking about, you know, how to take care of yourself. If you know, kind of have that tendency to rush to take care of all the things for other people, right now we might be saying, what are you doing for yourself? We might also be talking about working towards the duality, working towards balance. So again, there's nothing wrong with finding, again, moments of joy or moments of connection or some of the things that are going well during this hard experience that we're all going through. But that's not the entirety of it, right? There's not only that, you know, silver lining. We can't only be in that, because the truth is that there's a lot of really hard and bad things happening to lots of people. You know, using their powers of connection to reach out on the phone and to connect with the community. So these are the kinship caregivers. You know, these are the people who are connecting. You know, they're the ones that call everyone and their family and keep everyone connected. That's wonderful. They can do that and they can connect people, but also with this balance of learning to say no and learning to take care of themselves. And then also like seeing that they're valuable people, right, who have value in and of themselves, regardless of what other people think or regardless of how much they do for other people. So that's fun. So I want to talk a little bit about flock. Probably a lot of you all don't know about flock. Flock is that experience when something happens, right? So maybe there's a loud noise, or maybe there's a big event. You know, you might think of it as like a, you know, like a kiddo at a park, hears a loud noise. The first thing they do is like look up, right? And they look towards their caregiver. We all do this. Anytime something happens, like most of us will do this. We look up, we stop, we look towards others, we try and see like, what are other people thinking about this? What are other people doing about this? And acknowledging that actually FLAC is actually the beginning stages of feeling dysregulated. And what we're doing is we're checking in to see how others are perceiving the threat. So it's a process in which we're individuals, right? But we're experiencing a shared or persistent burden. But we connect together to share, mobilize resources for positive adaptation. So like we sort of come together and say like, what are you all doing? What are we, how are we going to do this? And I want to just sort of point out though that, normally in sort of like any type of natural event or natural disaster or sort of big, event that happens, we actually would have the ability to come together. There's that, after something bad happened, people actually find a lot of strength in community. But because the unique experience of COVID is forcing us to have isolation, right, at a time that we would naturally flock together, we aren't able to do that as much. And so we're left a little bit to our own devices. However, I still think that this concept, there's ways to do this, and there's ways to think about this both in the small scale. So for instance, when your kiddo or your family, your kiddos in your family look up to you, right, when something happens, to kind of gauge what their response should be, we can still be using this idea of thinking about how can we respond to the people in our lives in ways that can help them regulate and help them sort of find a path through, so that they don't necessarily rush into the fight, flight, freeze or fawn, or maybe they're not, they're able to come back from it. So, thinking about how parents respond to kiddos, but also this isn't just for families. This is like how are supervisors supporting employees, right? How are organizations or institutions supporting, right, all the people in their organization, their employees and their clients, right? We can even think about how is government supporting, right, their constituents and supporting their constituents. And so one of the things that I might really encourage us to do is think about who are the people that in this initial, like when something happens, so maybe it's a new news story, maybe it's, another, closing of schools or, any of these events that keep happening, but who is the person that you would want to sort of look towards that could help you frame what's happening and sort of figure out who your response would be. That may not be the general social media, that might be like a particular person. So I think our instinct is to be like, oh, social media, what's everybody saying about this? And then you get like 10 different opinions and 10 different perspectives on this. All like well thought out and important things that people are saying out there. But in this particular time frame, I might encourage us to think of just a couple of people or places that we might want to either get our information from or get our initial support from when big things happen. And that could be a person. It doesn't have to be like, a health, site or something like that. And so really thinking about this flock as a really great opportunity to help everyone, our clients, our family, ourselves, to like have a moment where we reflect on what's happening before we sort of move into fight, flight, freeze, or fawn. So I'm gonna just give a couple more slides on some strategies for navigating kind of what's happening right now. And there's, in this social media world, I have found a couple of things that have come across, my scrolling, if I'm being honest, that I was like, oh, this is actually good advice. And I really want to hold on to this because it's not all good advice. And so I really want to highlight the ones that are. And one of the best strategies right now in a situation in which we don't have control over many things that are happening to us is really focusing on the things that we do have control over. It's a really great strategy for managing, any of those responses that I was just talking about. What do I have control over? And focusing on those things and learning to let go of the things that we don't have control over. So these are just some examples, but I might pose a question, or what are some other things we can control, right? We might say that we can control how we respond to our kiddos. We might say that we can control, how much, for some of us, how much we're allowing ourselves to work or not work, that, not all of us have that choice. We might be able to say, I have control over, how I'm feeding myself or taking care of myself. and thinking about some of those things. And I might just have you wonder and, jot a list down to yourself of what are the things that you might add to this list that you know that you have control over. The other thing is we have control over how we're thinking about things, even though we don't often feel like we do, so when we're in a really anxious state or when we're in fight or flight, we don't necessarily feel like we're in control of our thoughts and our feelings. However, I would encourage us to know that we may not, again, be able to do one thing that completely turns off that anxiety. Back to that, like we're not looking to have it go away, but we might learn that if we do some of these things that our anxiety ticks down just enough that we can refocus on whatever it was that we were doing, and then our anxiety continues to come down. So, really thinking about sort of how are we framing our experiences and what are we saying? So, a couple of things on the screen. I'm stuck at home, right? Really shifting that into, actually, I get to be safe at home and spend times with family. I also want to just be very careful that we're not assuming that everybody is safe at home, and we're not offering this to everyone as like the solution to managing anxiety if we're really not clear on what's happening for them in their experience. A fear of I will get sick, right? So really framing it of I actually can do lots of things to keep myself from getting sick, and these are all the things, right? So a great strategy for managing worry and anxiety is to make a plan. And then when that worry and anxiety comes back up, you say, I have a plan. These are all the things that I'm going to do. And there's more here. I'm not going to go through all of them, but really, saying to yourself, like, actually saying, like, what am I saying to myself about this experience, right? What is the story that I'm telling myself, right? That I'm at risk, right? That something horrible is going to happen to me, or that I'm taking all the steps that I can to keep myself safe. And that's the best I can do right now. So I'm going to switch gears a little bit to thinking about, how we might be applying some of these when we're actually providing services through telehealth. And just wanted to talk about some of the things that, I'm definitely hearing, and I will say honestly experiencing myself. And so thinking about the challenges of telehealth right now, I found this great quote. Sorry, I forgot to reference who it was, but it's easier being in each other's presence or in each other's absence than in the constant presence of each other's absence. So I will definitely tell you that through my work, both supporting parents directly and just my everyday work, I am in constant contact with people on Zoom, like all day long. At the end of the day, I will tell you I feel quite exhausted. And I'm one of those people that, are not really finding the ability to connect with other people in my lives because I'm so overconnected during my day-to-day experience. And so I'm not using that as, my particular self-care right now, because that wouldn't feel like self-care. That would feel like torture. And so I'm okay with that. But some of the things that, we're seeing is this kind of connected with our clients, but also disconnected, right? So we're connected in a way that doesn't quite feel the same. And, not as connected. So we have that disconnected feeling. Also this experience of when you're on a Zoom call with a client or, whatever platform you're using, this sort of like, we're finding that we really need to like hyper focus on the client. And that's incredibly we use all of our energy to do that. And if we're either hyper focused or conversely, we're sort of distracted and it's hard to engage. It's obviously all new and different. We're also, seeing that some clients really don't like it. Some clients don't have access. They don't have the right, they don't have the access to high enough bandwidth. They don't have the hardware to do, especially video calls. Like I talked about, many people are feeling exhausted. And these are all the experiences that were happening on top of sort of our, our whole lives that we're experiencing as people, right? So what's happening with our kiddos, who we have in the home, our own worries about our family and friends and loved one and ourselves. So there are opportunities though. So I don't want to sort of paint this all, there's certainly clients who don't like it, but there's actually many clients that really do. I have a lot of clients that are really liking it. And what's interesting is in my new parent support group, I'm finding parents that haven't been able to attend in a long time. They attended when they had a short leave when their baby was young, and now they're able to attend again. And so, in some ways, like they're able to access more care than they have been. We know that telemental health or telehealth works. It's well researched. It has a good research base. Like I said, it can increase access for families who experience, all the barriers to care that we're normally on these webinars talking about. And then there's also this piece of that, for some clients, it can really actually increase safety and control. So if you can imagine, coming into a client coming into your office, there's a lot of power differential there. Even a home visit, you coming into a client's home can be very exposing for a client. And so, telehealth really gives clients a lot more control over their experience. So the basics, I'm sure you all, it's been, I don't even know how many weeks, 5, 6 weeks of us trying to figure this out, have come up with some ways of sort of doing this the best you can. But here are some of the things that, I've been experiencing and definitely learning from all the providers that I've been in contact with, that it's really best, with online services to reduce distraction. So I think there can be this really high tendency to be multitasking. And, we get distracted by, the other tabs on our screen, for instance. And so I really recommend closing all the tabs on your screen, doing full screen mode. If you are doing video, chat, turning off the phone, so that you're not getting disrupted, and really doing kind of everything that you can to create the environment in which you really are present for the client. And that might also be sort of, being honest with yourself about your current energy level and how much energy you have for seeing clients on that day, and really honoring and validating that it's exhausting and hard. And if you do need to see a client anyway, sort of validating that, deciding what you might do to take care of yourself and then, meet with that client. So for those of you that do home visiting, I did home visiting for a long time. We used to talk about the front porch meditation, which is before going into a client's home. You really just had a minute to ground yourself and be ready, to meet with that family. And I think you can use that idea in no matter what you're doing. So if it's a telephone call, a video call, just taking a moment, where you create a small ritual before you meet with a client is really a great practice, no matter how you're meeting with clients. And then the other thing that I've noticed, because I'm on my computer, I've even had the tendency to be like, oh, I'll look up that resource for you right now while we're talking. And what I've really found is that it's beneficial to either have the materials you need beforehand or do that afterwards or at the very end of the session, and to not be trying to multitask just because your computer's in front of you. And that's something that, we've become accustomed to doing in other ways. At the beginning of every video or phone call, again, because we can't necessarily see what's going on, we really want to check in with the client and find out, like, is this a place that you can talk freely? Are there other people around? Are there things, that you don't want to talk about today? Just let me know. So, you're telling this to the client so that they know, that you sort of are kind of aware of their life circumstances and are not assuming that everything is business as usual when it's not. If you're using some sort of technology at the beginning of every session, you need to have a plan for what happens if the technology doesn't work. And so, whatever that plan is, like you make sure you have the phone number handy, and you'll call them back and finish the session on the phone, or whatever it is. If it's like, massive failure, I'll call you back at 4 p.m. or something like that. So you have a plan so that the client doesn't just get sort of dropped if the technology doesn't work. So Alice asked me to talk about screening virtually. And again, I just sort of want to remind you that it's not necessarily different. The principles aren't different. It just could be a little bit more challenging. And so I really want to encourage us all to think about screening as a conversation and an opportunity to deepen and build your relationship with your client. It's never a task to check off. Our mental health is never a task just to check off, right? Our mental health is something that we should always be talking about and engaging deeply in. Other reminders: the day that you screen should not be the first time that you're talking about emotional health with a client. If you're a home visitor, or if you're doing sort of any type of maybe non-mental health related care, we really want to be talking and normalizing talking about mental health with our clients. If you're in a program that has sort of routine screening and you screen at certain times, you're going to want to introduce screening in ways that lets them know that that this is normal, and something that we really believe in. And so I gave you just like a little script here. We believe in supporting clients' health in all ways. This includes emotional health. It can be helpful to use a tool that's specifically designed to screen for depression. Would you like to complete one today? If a client's mood has changed, and you would like to check in with the client about that, again, I gave you sort of a script here. It sounds like the last few weeks have been really hard. Have you wondered if you might be depressed? Do you know the signs? And then, one of the benefits of screening is that you get a baseline, right? So if someone is not depressed or anxious, or if someone's a little depressed or anxious and then something changes, right, you have the opportunity to see those changes. That's what is really great about it, So you might say something like, we completed a depression screen in November and we can complete one again and see if anything's changed. Sorry, there's a little typo there. Like, would you like to complete one again? Would you be interested in sort of, how your mental health has changed? Again, so it's a conversation in which you are, talking about screening versus like giving a screening or, doing something to the client. It's something that we're doing together. So some of the challenges is, if you're screening via telehealth and you're not like a routine telehealth provider, so you maybe don't have like a, awesome platform that has some like automatic, tools, for folks to like complete their own screening on a form online or something, then you're going to have to verbally screen, right? So, so it's a little different for sure. So it can feel harder, I think, for parents to perhaps answer the questions on the screening. But we also know that verbal screening works. It is something that is allowed and can be used. The best practices would be to read the questions verbatim. So you're not trying to explain the questions. You're really just reading them to the client and then recording their answer. And then the other thing is the PHQ-9, if that's what you're using, and many of the other, the GAD-7, Edinburgh, a lot of the screening tools for any type of mental health complications, or even specifically perinatal mental health complications, are available in many languages, and I encourage you to use those translations versus trying to translate for yourself. And then again, waiting until the screening is over to talk about sort of the questions. So not necessarily having it be super conversational after each one. It could take a long time to get through it. And then something that we were talking about the other day when we were preparing for this webinar and thinking through what some home visitors are doing that use materials, is thinking about, it could be helpful to text the parent or send a copy to the parent, not for them to fill out without you, or to fill out, or to even review beforehand, but even just so they have something to look at, like actually while you're doing the screening, so they can reference the questions. Because sometimes it can be like, what are the answers again? And what are my options? And so, they can be reading it and then telling you. Could be another strategy for screening. So after the screening is done, again, these are the same things you would do in person, really. So there's not a lot of differences. What questions do you have now that you've filled out the form? Like, you would really, again, a screening tool is not necessarily, we score it and we tell the client about their mental health. The client is an expert on their own experience. And so, I would be, way more interested in what the client thinks about filling out that screening form and what the client learned than only what I learned about, their answers. So things like, what did you notice? If this is in reference to the PHQ-9, which is a self-harm question. If you checked, I noticed that you checked item question 9. Can you tell me more about that? So that's really checking in on whether they disclose some self-harming thoughts or self-harming behaviors. What do you think is going on? What concerns do you have? Really thinking about, like, have you heard this? Have other people said that they might be noticing some of these things? So checking in with, oh yeah, my partner has said that I've been really grumpy and irritable recently. Oh, did you know that that was actually a symptom of depression? So, really having an opportunity to have a discussion. And then again, I think that we often think that if you screen and someone has a positive, screen on, let's say the PHQ-9, and so they, are, perhaps, in a high risk for having depression, we think, oh, the answer is then to refer to mental health. And that is not the wrong answer, that might not be the only answer. And so again, thinking about the client is an expert on their life and might have ideas. They might know, they might have experienced this before. They might have things to offer about, helping themselves right now that you just wouldn't be able to know. So what do you think would help you right now? Would you like more information about what mental health treatment will be like, right? Some people need to know, like, what can I expect, thinking about what have they tried already? If the client has experienced depression or anxiety in the past, what's worked? Would you like me to stay? How would you like me to support you? What do you need to take steps towards taking care of your mental health? What's stopping you? Again, these are all, right, like putting everything in the client's, like it's theirs to sort of take the next step with, and you're there to walk along with them and to support them and not say, oh, you need to do this or you need to do that. If they're quite depressed and you think that they would benefit from a mental health referral, you could say that. You could say, based on what I'm seeing here, it sounds like you're pretty depressed. Would you agree with that? Have you thought about seeing a mental health counselor? What are your thoughts about that? Because the truth of the matter is, even if you think they need to go to a mental health therapist, if they don't think they need to go to a mental health therapist and they're not going to take you up on that referral, just making the referral isn't going to necessarily work. You really do need to work with the client and find out what are the barriers, right? And it might take 6 or 8 weeks for them to address their ambivalence of, all the many things that, it takes to go and make an appointment with a mental health therapist. And so if a mental health therapist is not the thing that they're ready to do, what are they ready to do? And so, the other thing that I was asked to do is to really provide some concrete referrals and give you all a sense of what is available. So I just wanted to give you like a quick kind of overview of like the mental health landscape right now. So surprisingly enough, what we're finding in the mental health world is actually what we think is a temporary lull in services. There's either referrals are down, or referrals are like really inconsistent and like coming in spurts and then like having like quiet moments again. And so right now, for instance, like before this webinar, I went and checked a couple of the community mental health centers that are local to at least King County. I know some of you might not be right here in King County, but the community mental health centers have all transitioned to online. They're all taking new clients. So mental health services are available. In the private practice world, almost everybody has moved to online therapy, and there are definitely, there is capacity. I don't know what's going to happen with that. I think there's some talk around kind of, initially people are sort of kind of hunkered down, are experiencing lots of barriers to care as well. And we're expecting sort of an increase to come kind of at some point in the future. And so I don't know what capacity will look like in the future, but right now there is capacity. And then specifically around perinatal mental health resources, PS Washington has been compiling a list of any virtual resources that we know for perinatal mental health providers. So we have a good long list because a lot of people have really switched over. There are many virtual support groups. I think PS Washington has 4 or 5 that we're running. And there are more than just PS Washington. So for instance, the National Postpartum Support International are running virtual support groups. Those are also listed on our website. So we're not just listing our resources, we're listing any resources that we know. I know that PSI, so Postpartum Support International, has a few more specialty groups. So they have groups for folks, families in the NICU, which is something that parents with kiddos in the NICU are facing access issues to their kiddos, which is creating a huge trauma. So they have a NICU specific support group. They have a military family support group, which you can imagine anxieties are also high in that group. They have Spanish speaking support groups. So there's really a lot of great resources. And then the other thing that PS Washington has compiled is a lot of the wellness resources that have also moved online. So we have lists of all free, online meditations in English and Spanish. We have like a movement and yoga list, and have some specific resources, for instance, for communities of color. Resources for and by providers of color for communities of color. A lot of the, we have a lot of resources like videos on like managing emotion regulation. So like for instance, using DBT or using another one on ACT, which is another therapeutic modality. So, you know, some videos that parents can watch, and then tons of articles for both you and that you can share with your clients. It's all available on Perinatal Support Washington's website. And right now we have them as Google Docs. And so we're putting in just a date on the top of like when we've updated it, just so that you know how updated the referral information is. So just some things that we're noticing. Common themes, of course, increased anxiety, fear and concern over health and safety. We're really hearing a lot of financial stress and some real worries. In my support group at the beginning, I run it every week, but at the beginning of the month, I run it on a Friday. And so on April 3rd, I think I had 3 or 4 moms in my support group that hadn't paid rent that week. And were retaining all the money that they had to pay for groceries and diapers and formula because they didn't know when another paycheck was coming in. So, you know, financial stress, I think, is really one of the big ones right now. And then the parenting stress that goes along with that. Parents feeling really irritable, feeling like they can't do a good job parenting and work and manage kind of everything that's happening. We're hearing a lot of anger and rage and sadness over the structural and systemic inequities that we're hearing from all of the families. And then, of course, grief over sort of just what's happening for communities and for the people in our lives. Some of the themes that we've been hearing from the helpers, which I really want to sort of encourage us to address, is, you know, our feelings of our own inadequacy at not being enough or doing enough, right? That we can't solve COVID-19, we can't solve all the financial concerns, we can't solve all the things that are happening for our families, and that's feeling like that means that we must not be doing enough. And I really want to encourage folks to think about that the relationships that you're building with families and the services that you're providing for families is important, even if you can't solve all of their problems. And so I'm really hearing that folks are you know, burning themselves out and working so hard to try and care for families at the same time feeling like they're failing. And I really would really love to address that as a community. You know, also hearing from helpers feeling angry at the inequities and the disproportionality of how this is affecting certain communities, communities of color and urban communities, feeling afraid for our clients and what they're going through. And then also sort of, you know, balancing that feeling afraid for ourselves and exposure to COVID-19. And then this piece that I think, you know, I'd like to just sort of put this out there, and I have just one more slide about this to talk about this, but this really feeling trapped between the overall public health good and the individual health of our clients and how we navigate that as providers, I think is something that's a really important conversation that we need to be having. And I think we need to be having it sort of on a program level, because every program is going to have their own policies and procedures. But I think that that's a big theme that's coming up for helpers. You know, if you are finding that you need to address risk, which is something that, you know, I think that there's a lot of increased mental health risk right now. And if you have concerns about safety, right, the way that we would do this remotely, again, the principles are the same. So it might feel like we don't have sort of the things that we need to address risk, but we do, right? We've been trained in this. We know how to do this. It just doesn't feel the same way. And so the principle is always the same: be gentle but direct, right? If you have concerns that you think a parent might not be safe, you need to ask. You need to ask clearly and directly. If you have concerns that you might act on these feelings, if you feel afraid right now for your safety, are some very simple ways that you can ask parents how they're doing. And then, you know, the tricky part is because you're not there with them, right? And because it's harder to access in-person services, right? Depending on, you know, I sort of framed this slide for folks that are not necessarily mental health professionals. I think mental health professionals know how to navigate crisis and get a lot more training in that. But if you're not a mental health professional, then I encourage you to connect that person with a mental health professional. So if they already have a therapist, or if they use services at a community mental health agency, you know, 9 to 5, there's always an on-call therapist. So would they feel comfortable connecting to them? If not, or if they're not connected to a therapist, then the crisis line, and there's phone and text options. And I would encourage the parent to use those and to call those with the phone, with you on the phone. If they refuse and you feel concerned about them, you can call the crisis line and ask for help and support and what to do as well. Your program might also have policies on this. It might be, connect with a supervisor before you take any steps on your own. And so I would encourage you to check with your program supervisor. And if you all don't have like some policies and protocols for managing risk during this particular, unique time that we're in, I would encourage you all to sit down and talk about those now and create some policies, because it also sounds like we're going to be doing the social distancing for a while. And so it's time to start making some of those changes in policy. And then again, if you're working with a parent, who's experiencing a mental health crisis, really thinking about, is the parent alone? Is there someone else with those kiddos? And then again, this kind of gets back to that social distancing dilemma of how we support a parent in this circumstance, who might be a single parent, right? Is there someone that parent can call to support them right now? Is there someone that parent can identify that you can connect with to talk about mental health? Because this piece of not really being able to see them and not really having great access to the parent, if they drop off and are no longer in contact with you after you have assessed or at least wondered and maybe have some fears that there's a mental health crisis, you need to be able to reach out to somebody else in that parent's life. So these are some of the unique things that I think that are coming up during this all remote services. The only other thing that I would say is, again, it sounds like there's some things coming up to help, folks that are working with parents right now around parenting stress. But we know that as mental health, experiences perhaps worsen, that parent stress goes up, and so does the potential for child abuse and neglect. And again, I would have, very open, gentle, direct conversations with the parents and wonder about what they're feeling about it. Are you concerned about your parenting right now? Are there supports you can bring in? And again, these are some of the things that, for some of the families I'm working with that I'm, having to think about, but I really want you to encourage you all to think about this as a program, because you all have to comply with social distancing and, program policies and procedures. And so, how are you all, but I'd be really curious to have this question, how are you all supporting families that are in pretty dire situations at home, perhaps single parents who are pretty overwhelmed with their own mental health and parenting stress? How are you all approaching that? That's a really challenging situation. And sometimes I feel like I'm in a bind between this, public health, and individual health. And it sounds like the folks at Ounce have told me that there's a webinar next week for you all on this, that I think Elisa said that she could post for you all. I encourage you all to go. I think I might go and get some support on that. And so this overall question that I've been posing, right? How are we balancing public health and individual health? I don't want to phrase that as or individual health. It's not one or the other, right? How do we do both? And I really think that folks need to be, sitting down on teams and sitting down with supervisors and thinking through, how are we addressing this issue of, parents that are really struggling right now and need more support than they're getting. And unfortunately, I don't have the answer to that. I have some ideas. I'd love to have conversations with folks, but yeah. And then just quickly kind of thinking about this, how do we take care of ourselves? How do we navigate this time and build resistance? So going back to some of those kind of seeds that I planted at the beginning of this webinar, how do we find meaning, right? And perhaps our role as helpers can help us find meaning. Perhaps our role as parents, right? The most important thing to us right now is taking care of our kiddos and making sure that they feel safe and protected. Perhaps as a healthcare provider, what helps us sort of find our way through this experience? Can we find grounding in our cultural ways of navigating difficult times? What are those? And then other strategies, can we align with our values? So one thing to really think about is, who do we want to be in this pandemic, right? When we look back at this time, who do we want to see that we were? And how can we align the things that we're doing with our values? And so that doesn't mean that we need to go out and save the world, right? That might mean that, I'm going to call my, Aunt Helen, once a week and connect with her because I know that she's totally alone. So again, thinking about we don't have to take it all on, but what can we do that really helps us be in line with who we think we are, who we want to be, who we feel like we need to be. And then Behavioral activation strategies, I talked a lot about this in the fight, flight, freeze, and fawn. Those are doing those things that bring joy, or finding little moments of joy, or finding activities that help us feel alive and connected and grounded. And then connection, but in parentheses, if that feels good, because like I said, for a lot of us who are in constant connection with our clients, that may not be our go-to, right? Our go-to self-care might be staying home and really being quiet and like literally like letting our ears rest, if that's, you know, something that would be helpful for us. And that brings me to the end. So I'm really happy to how about I will stop sharing. So this is my email and this is the website. So feel free to be in touch. I'm gonna stop share and then I'll be able to see. So questions, comments, I'm happy to, there's a lot of people on the line. So I think we'll just manage that as best we can. Elisa, do you have any strategies for navigating this next 15 minutes or so?
I think if people want to take themselves off mute, they can. Just be mindful that we do have a really large group here. It might be easiest to type in questions into the chat.
Okay.
We did have one about finding mental health providers who take Molina.
So two strategies. So unfortunately on our like quick list of providers that take telemental health, is this for perinatal mental health specifically? I might wonder. If it is perinatal mental health, I would say like our quick list of telemental health providers, we weren't able to like capture all of their insurance information. And so the best strategy would be to email us and we can sort of help navigate that. Oh, hey, Deborah, was that your question? Mental health for folks that have Molina that is not perinatal mental health, is that right? If it's not perinatal mental health, then all of the community mental health agencies are open for business and taking clients, and they all take Molina. Yeah. Yeah, so community mental health is your go-to. The other thing that you could do is, again, for the non-perinatal mental health population, Psychology Today is a great website where you can actually search by location and by insurance. And you also can search by, you know, like different types of issues that the client might have. So, you know, kind of whatever it's related to. And that could be a great strategy. The other thing is, you know, you can search by location for when this social distancing is over, or, you know, in some ways there's actually a lot more providers available through a platform like Psychology Today if you no longer have to search by location. And so the thing I will say about that is, you know, people in the urban area like Seattle are less likely to take Molina because of the reimbursement rate. But in areas where cost of living is less, we actually see more providers that take Molina. Not a ton more, but more. It looks like there's a question about 211. I don't know a lot about 211 other than you are on hold for a long time. Does anyone else know if 211 connects people to you're talking about the mental health resources I mentioned? I don't know if 211 actually provides mental health referrals. Does anybody know? Lisa, do you know?
I don't know.
Okay. Yeah.
Unfortunately.
Sorry, I don't know the answer to that question, Maggie. Looks like Deborah says she does not believe that 211 connects people to mental health resources specifically. Someone just posted that there's something called the Washington Recovery Helpline, which can help people find a behavioral health provider. And that 211 is more about financial or housing or more concrete or basic needs, it sounds like. Other questions about supporting families? Also, anything about perinatal mental health, I'm happy to answer, or perinatal mental health resources. Looks like someone just posted that the Washington Recovery Helpline is 24/7 and they're keeping up with C19 changes. That's great.
In addition to questions, I wonder if anyone has any like particular strategies or recommendations that have been working for you that you'd like to share.
Mm-hmm. Yeah. So someone just posted a resource. I'm not sure what that is. It's voawww.org, behavioral health. It's probably a behavioral health resource for you all to get referrals. Let's see, any thoughts specific to supporting fathers or caregivers other than mothers? I guess I wonder is the question of how to support them or what are the resources for them? There's actually, there's definitely resources for fathers and partners other than mothers. So for instance, our warm line, we have dads on the line and dads can call in and talk to another dad and they can talk to another dad who's either experienced their own like depression or anxiety following the birth of a child or supporting their partner. And then, oh, I see. So an update is, the question was how to support fathers and partners. I guess I think that, you know, I wonder about, you know, what might be different about supporting them other than engaging them. You know, I think that potentially, depending on who's on the line, what I hear from lots of providers is that they're mostly in touch with the primary birthing parent or the mother, because those are the folks that we target in our services. You know, but if you all have access to the partners and dads and those, and they're around and you have access to them, I think I would simply start by saying, how are you? How is it going? You know, what's happening for you? And the tendency might be for them to talk about other people in the family, how their partner's doing, how their kids are doing, and you know, continuing to ask them. The other strategy that I think is really important for dads that actually is a huge you know, preventative strategy is to actually engage them early on, right? So you're not engaging them, you know, when they happen to be there randomly at one of your appointments with the birthing parent. You're intentionally engaging them early on. You're engaging them, you know, if you're working with folks prenatally, you're engaging them, you know, you're also seeing them as their own person, you know. So again, if we're talking about perinatal mental health screening, a lot of folks hand that screening to the birthing parent and say, here, like, you know, complete this form, and the partner is sitting right there. And, you know, I would wonder, like, why are we not giving a screening form to the partner as well? You know, if the birthing parent or the mom is at risk for any type of perinatal depression or anxiety, like, so is that partner. And so I think the best strategies are engaging them early on and engaging them as their own person, right? They're not there to support the birthing parent. They're the other parent, right? They're there and they need support as a parent themselves, not as a helper or supporter. So that would be my question. It looks like, does the perinatal warm line have specific hours? And if they are closed, do you have a next resource to send families to? So the our warm line is open 9 to 4:30 every single day, live answer unless someone's on the phone, and then we'll call them back right away. If somebody calls in the evening, we don't have someone to answer the phone live. And actually, our, you know, even though we have live question or live warm line, it's not a hotline. So if a family really needs to talk with someone sort of right away and can't leave a message and get a call back, like even if it's a few hours later, then the best option would be a crisis line or something similar to that. But if a parent calls our warm line in the evening, we do have people that answer the phone and respond, but not often like live, you know, right when the person calls. So I don't have another perinatal mental health specific resource. There is in Illinois, I think it's Illinois Masonic actually has a postpartum depression hotline And it's not necessarily nationwide, but they don't turn people away. You know, so if you have a parent in particular that you're concerned about, that you really want them to have a resource, I would use that resource sparingly, because if we bombard them with, you know, folks outside of Washington, they might clamp down on that. But I certainly think that could be a resource for you. Looks like that was from Jamie. Jamie, I could find that link for you and send that to you, or send it to Elisa and send it out to everybody. Let's see, do I have favorite apps for anxiety, breathing, or guided imagery? I do. There's actually so many resources, which is maybe why you're asking that, because there's, you know, amongst all of them, how do you choose? I've listed a couple of the ones that I really like on the Perinatal Support Washington website. So UC San Diego Mindfulness Center and UCLA Mindfulness Center both have fantastic, lots of online resources. They have audio links in English and Spanish. They also have some movement links, and they even have like a COVID-19 response. I think the UC San Diego has a COVID-19 response, you know, in their mindfulness center. So that could be a really great resource to check out. And then also on the Perinatal Support Washington website, we've also we've listed resources for different communities. So for instance, you know, mindfulness-based resources for Spanish-speaking parents, for Native or Indigenous families, for Black, African-American families. So, you know, if a parent or a client might prefer to have something that's more culturally specific, you can find those resources on our website. Let's see. For telehealth visits, I texted a family one day prior to the appointment, asked if 30 minutes, 45 minutes, or 1 hour visit is preferred. Also make sure that I have unlimited minutes. Oh, make sure that they have that, right? So it sounds like Maggie is suggesting to really give families the option of sort of what amount of time they might need, and also checking in on if they have minutes, and then sort of thinking about how they might want to use those minutes as well. I think is definitely something that needs to be talked about. You know, we were just talking the other day about this webinar that, you know, some families don't have any access to any type of online, you know, internet. So it's only phone minutes on a phone, and then you know, those minutes are also very valuable. So thinking about that. So we just have another minute or two if anybody has a comment or a question. Seems like there's no more questions or comments. So I want to say thank you all for being here and taking the time. I know that there's in some ways so much information out there. And so I'm hoping this is helpful. And it looks like some folks are posting some resources for access, minutes and internet access for clients on the chat. So you might want to check out the chat.
Thank you so much, Mia. We just so appreciate your expertise and for you sharing today. And thank you everyone for participating and for your great questions and for sharing different resources and links. We'll be sure to include all of those when we send out the slides and the recording. Make sure those get passed along. So
okay. Thanks, everyone.
Thank you so much. Enjoy the rest of your day.
Yeah. Bye.